My dear students, welcome to the session Ayurved Panchakarma Basics. You might have heard the word Panchakarma either on TV, in print media, or in advertisements. It is a specialty of Ayurved treatments. This is a great opportunity for all of you homeopathy aspirants to get familiar with specialty of Ayurveda. Let us understand scientific basis of Panchakarma. Objectives of this session are: at the end of the session, first year homeopathy students should be able to understand the Ayurvedic view of how exactly diseases occur, enlist types of Ayurvedic treatment. Every medical science is having different modalities to tackle the diseases. At this point, we will come across different Ayurvedic modalities of treatment. All you students should be able to enumerate Panchakarma procedures. How the word Panchakarma was derived, which are the different treatment protocols in Panchakarma that we will be covering in this topic. Explain benefits of Panchakarma. Though scientific indications and benefits of each Panchakarma are different, still we will get to know some general benefits of these procedures. Also, we will look at the general indications of Panchakarma too. You will realize what is Purva Karma and Paschat Karma. You will get familiar with some pre and post procedural care techniques which at times can be used as main line of treatment. You will know the methods of procedures along with its advantages for our health, as you would be able to explain various Purva Karma with their benefits, understand various Pradhana Karma with their benefits, know what is Paschat Karma and its uses. You will see some of the supportive or secondary Anya Panchakarma also at the end of the session. First, as you know, the prime aim of Ayurveda is Prayojanam Ayurvedasya Swasthasya Swastha Rakshanam Aturasya Vikara Prashamanam, to maintain healthy state of life and get rid of the diseases. Just like modern medical science, we need to understand pathology before knowing the treatment part. Similarly, it is essential to understand the view of Ayurveda regarding how exactly disease occur. Let us take a quick revision of Rog Nidan session which was covered previously, where you have understood disease pathogenesis. You might have understood that there must be some cause of dosha aggravation called hetu. Due to these different dietary, behavioral or seasonal and other causes, dosha increase in quantity in their own place. We call it as sanchaya. These dosha circulate all over the body. We call them as prakopa. Dosha gets lodged in some part of the body. We call it sthana samshraya. These dosha disturbs the structure or function at place there, leading to some signs and symptoms. To sum up a long story short, the combination of aggravated dosha along with dusha body structures leading to some abnormality structurally and functionally, we call all this process as disease. So, here you can see the illustrative diagram. Here, pink line represents our lifeline. Whenever all the three dosha are in equilibrium, which is represented as straight smooth line, as we maintain a good healthy state of life. But in between we see pink spikes which represent excessively aggravated dosha wandering all over the body, disrupting our healthy state and leading to diseased phase. In further part, as a result of treatment, we can see straight and pink line which represents that the healthy state of body is being restored by the treatment. I am emphasizing a very essential aspect of disease pathogenesis, which says the fundamental cause of diseases is abnormally aggravated dosha. treatment modalities of Ayurveda. These aggravated dosha can be neutralized in three ways, which are three modalities of treatment. These are Shamana treatment. This is slow and steady process of pacifying. With the help of medicines, we gradually reduced quantity of aggravated dosha. In Ayurveda medicine preparation session, you might have seen various kinds of medicines like Swarasa, Kalka, Kwatha, Hima, Fanta, etc. These different forms of medicines are used in different doses as per different disease conditions. These medicines bring aggravated dosha back to normal state and restore health. Second modality of treatment is Shodhan treatment. It is treatment of elimination. Excessive dosha causing diseases are eliminated from the body with the help of 5 detoxifying procedures. These procedures are very popular with the word Panchakarma. We will see Panchakarma in subsequent slides. Nidana Parivarjan. Here, Nidana is cause and Parivarjan is to avoid. So, Nidana Parivarjan is stopping exposure to disease aggravating cause. As per Ayurveda, food material having bitter, spicy, astringent taste, cold and dry touch, light in weight and fermented aggravates Vata dosha in our body. So, consuming this material with these properties must be stopped by the patient having diseases of Vata predominancy, like patients with joint pain. Ayurvedic physician usually refers it as pathya or parhez. Food materials having spicy, sour and salty taste, oily and hot in nature excessively aggravate pitta dosh. So, if someone is having diseases due to pitta aggravation like patients of hyperacidity, these people should stop consuming this material in order to stop further pathogenesis and improve response to the treatment given. Sweet taste, sour, salty flavored food, cold, oily, heavy for digestion food aggravates kapha dosha. People having diseases like asthma, which usually are due to excessive aggravation of cough, shall avoid consumption of these kind of food material. Stopping exposure to these cause can help patient in multiple ways. It will stop further aggravation of dosh, it will stop further harm to the body, it will help body's quick response to the treatment, and it can give early recovery to this deceased fellow. So, Ayurvedic treatment modalities are of these three kinds. First is Shaman, that is pacifying. Second is Shodhan, that is elimination, which is popular with the name Panchakarma. And third is Nidana Parivarjan, which is restricting aggravating factors. Hereafter, we will concentrate on Shodhana Chikitsa, that is Panchakarma treatment. What is meaning of this word Panchakarma? Actually, the word Panchakarma is derived from two Sanskrit words. First is Pancha, which means 5, and another is Karma, which means procedures. These 5 procedures are namely Vamana, Virechana, Basti, Nasya and Raktamokshan. General benefits of this Panchakarma. If conducted properly, under guidance of expert Vaidya, the benefits of Panchakarma procedure are: it eliminates disease causing excessive dosha, it ignites and strengthens digestive fire, it clears and strengthens mind, intellect, sense organs and improves complexion, it delays aging and maintains the health. To whom these Panchakarma are indicated? Considering all the above benefits, you can understand that Panchakarma procedures can be conducted on healthy individuals for maintaining their health, and it can be conducted on unhealthy people to break pathogenesis of disease and to reduce the suffering. As a result of seasonal changes, that is Rutucharya, we see changes in dosha quantity, like Vasanta Rutu, that is environment with conditions like spring has natural tendency to increase kapha dosha. Sharad Rutu, that is post rainy hot season and humid environment like autumn, has natural tendency to increase pitta dosha. Varsha Rutu is rainy season. This environment tends to increase vata dosha. For everyone who wish to maintain their health, it is advocated to undergo Vamana Panchakarma in Vasanta Rutu for elimination of kapha, Virechana Panchakarma in Sharad Rutu for elimination of Pitta, and Basti Panchakarma in Varsha Rutu in order to remove excess Vata and balance Sharir Dosha. Whereas for deceased person, one shall not wait for seasonal changes but can give Panchakarma as per indication of the deceased condition. You might be surprised, why am I saying that these are the benefits of Panchakarma if conducted properly? It is because Panchakarma is just like a surgical intervention. The success of any surgery depends on well executed 3 steps: pre procedural work, main procedure, and post operative care. Similarly, success of Panchakarma treatment depends on the same 3 steps: pre procedural work called as Purva Karma, main procedure which is called as Pradhana Karma, post procedural care called as Paschata Karma. Let us understand and remember these 3 steps one by one. Purva Karma is pre procedural work. It has 2 different procedures. First is Snehan procedure or oleation therapy, and another is Swedan procedure or also called as Sudeshan therapy. Snehan therapy is also known as oleation therapy. Snehan procedure is having 2 types. One is internal and called as Abhyantar, and another Snehan procedure is external, which we call it as Bahya Snehan. In Abhyantar Snehan, internal Snehan, the patient is asked to consume a specific amount of medicated oil or ghee early in the morning for 3, 5 or 7 days once a day. Internal Snehapan is usually done before Vamana and Virechana procedures. Abhyantar or internal Snehapan helps in lubricating the gastrointestinal tract. It helps in executing Vamana and Virechana procedures without any complications. Bahya or external Snehan. It is a procedure in which patient's body is massaged with the help of medicated oil. It is usually done just before Vamana, Virechana, Basti and Nasya procedures. Benefits of Snehana are: with this procedure, dosha are dislodged from the site of disease formation. This is why we say that Panchakarma procedures support detoxification of the body. Snehan reduces Vata dosha in quantity as well as quality. Snehan strengthens the body. When consumed internally, this Sneha cleans gastrointestinal tract just like the castor oil does. Swedan, hot fomentation. The Sanskrit word Swedan means sweat. Any procedure in which patient gets sweating is considered as Swedan. This procedure is done either on localized part called as Sthanik Swedan, just like taking a steam inhalation for fomentation of face just before Nasya Panchakarma, or it can be applied to whole body, which is called as Sarvadahik Swedan, just like in the sauna bath before any Basti procedure. Application of heat leads to increased body supply, with the help of which dosha gets liquefied and dislodged. There are 4 different types of Svedana, which are Tapa, Upanaha, Drava and Ushma. In Tapa Sved, some material like sand, rice or medicated herb is heated and applied directly touching the body part. In Upanaha Sved, it is like a poultice. Here we apply hot paste of medicinal herb over body surface and wrap it with heat resistant material like leather. Drava Sved is the procedure in which we pour hot liquid over the body surface or immerse some part of body in hot liquid. Ushma Swed is that kind of method in which indirect form of heating procedure takes place just like in sauna bath. Benefits of Swedan. Swedan helps in bringing dosha back to the gastrointestinal tract. Hot fomentation reduces pain and vata dosh and strengthens whole body. Combination of Snehana and Svedana, that are Purva Karma, provides relaxation to body, increases receptibility to the treatments and enhance overall effect of Panchakarma. In Keraliya Panchakarma, Snehan and Swedan procedures of different kind are mainly emphasized. After successful completion of Purva Karma, that is Snehan and Swedan, body is ready for main detoxifying Panchakarma procedures. Name of 5 Panchakarma procedures are Vamana, which is procedure of emesis, Virechana, which is procedure of purgation, Basti, which is procedure of giving enema, Nasya is instillation of medicine by nasal route, and Raktamokshan, which is a procedure of letting out impure blood. Let's get familiar with them one by one. Vamana Karma is procedure of emesis. In this process, dosha or toxins are eliminated from the body by inducing vomiting in controlled manner. In pre-procedural work, the patient is given snehan in both internal and external ways and whole body swedan. This helps in liquefying and dislodging dosha as we learned previously. In main procedure, we ask the patients to sit in quiet place and consume liquid till he feels his stomach capacity is full. These liquids can be milk, sugarcane juice, or even medicated decoction. Later, we give medicines for induction of vomiting sensation. Usually, it is a powder of seeds of herb called madanfal mixed with honey. After waiting for some time, patient starts getting vomiting. All the dosha in gastrointestinal tract and the liquid gets eliminated from the body with this vomitous material. A doctor needs to monitor the patient keenly and treat them accordingly. A doctor uses different medicines for various diseases and conditions. In post-procedural care, patient is asked to take rest and follow specific code of conduct. Thereafter, patient is given diet to improve digestive system, which we will see in Panchakarma. Properly conducted Vamana Karma is used as Shodhana treatment for diseases of kapha predominance. It is also indicated in patients suffering from body structures above the level of heart. Successful use of Vamana Karma is very well seen in patients with allergic conditions, hyperacidity, indigestion, skin disorders, asthma, and diabetes too. Scientifically, controlled administration of emetic substances trigger the vomiting reflex, which helps expel accumulated mucus, toxins, and undigested material from the body. This process helps clean the respiratory passage, reduces congestion, and promotes respiratory health. Virechan is procedure of purgation. In this process, dosha or toxins are eliminated from body by inducing loose motions in controlled manner. In pre-procedural work, the patient is given snehan in both internal and external ways and whole body steam. This helps in liquefying and dislodging dosha as we learned before in Purva Karma. In main procedure, we give patients medicine that induces loose motions. These medicines work after getting digested. The doctor monitors and hydrates the patient intermittently during whole procedure. Dosha and toxins are taken out in controlled manner with this procedure of purgation. In post-procedural care, the patient is asked to take rest and follow specific code of conduct. Thereafter, patient is given diet to improve digestive system, which we will see in Panchakarma. properly conducted Virechana Karma is used as Shodhana treatment for diseases of Pitta predominancy and organs of abdominal region. Successful use of Virechan Panchakarma is very well established in cases of skin disorder, bleeding tendencies, jaundice, worms, and ascites. The administration of purgative substance stimulates bowel movements, increases peristalsis, which helps in removing toxins, bile, metabolic waste from the body. Scientifically, this process enhances liver function, improves digestion, and promotes detoxification. Basti is procedure in which we conduct bowel cleaning with the help of enemas. The word basti is derived from Sanskrit term that means bladder or container. In this procedure, we give medicated oil or mixture of proportionate ingredients along with the decoction to patients by anorectal route or by enema. Oil enema retain for substantial time and pacify vata, where decoction enema eliminates mala and excessive vata out of the body. The aim of basti is to balance vata dosha, cleanse colon, and promote overall health and well-being. In pre-procedural work, the patient is given only external snehan and swedan. He is asked to lie down on the left lateral position. In main procedure, enema is installed via anorectal route by specific instrument called as basti yantra. Doctor observes patient's condition and asks to evaluate the bowel when urge to defecate arises. In post-procedural care, patient is asked to take rest, follow specific code of conduct, and to have a simple diet after the procedure. These enemas of medicated oil or decoction can be given for 7, 15 or 30 days depending on the condition of the patient. Benefits of Basti Panchakarma are: Basti is advised in patients having Vata predominance or conditions of disease of lower body abdominal region and all the parts below it. Patients with osteoarthritis, osteoporosis, spine problems, paralysis are very well benefited from this Basti procedure. Scientifically, rectum is having rich blood supply and high absorptive capacity. When medicated substances are introduced through rectum, they are absorbed into bloodstream, reaching the tissue and organs throughout the body. This allows systemic effect and nourishing the body and promotes detoxification. Fourth Panchakarma is Nasya. It is procedure by which dosha at the level of above collarbone are eliminated by installing medicines via nasal route. In pre-procedural work, only external snehan and swedan are advised for facial part. In main procedure, the patient is asked to sleep with face upright position and extend his neck. The medicine in the form of oil, powder or decoction is instilled in nasal cavity one by one in specific amount. The patient is asked to be in this position for a while and later asked to spit out all the secretions collected in nasal and oral cavity. The same procedure is advised for minimum 7 days. Gargling with hot water and inhalation of medicated fumes are things that we conduct as post-procedural care. The patient is asked not to get directly exposed with cold environment for some time and to follow code of conduct which we will see in Paschat Karma. Nasya is advised for ailments mainly situated in head region. Well executed Nasya Panchakarma can be very helpful to treat conditions like allergic rhinitis, sinusitis, facial palsy, hair problems, migraine, etc. Nasya not only reduces symptoms but strengthens the power of sense organs. Scientifically, nasal passage is lined with thin layer of mucus and blood vessels. When medicated substance is applied at nasal mucosa, they are absorbed into bloodstream and it reaches brain and other parts which are in head and neck region. This process stimulates nasal mucosa and increases blood flow over there. It reduces inflammation and has balancing effect on doshas. Final fifth Panchakarma procedure is Rakta Mokshan. The term Rakta Mokshan is derived from Sanskrit words Rakta meaning blood and Mokshan means elimination. In this procedure, dosha which are situated in blood making the blood impure are eliminated by the process of bloodletting in controlled manner. In pre-procedural work, patient is given Snehan internally and Snehan Swedan externally for about 3 days. In main procedure, bloodletting can be done by different methods. One of the method is application of leech. Leech is applied over the specific areas of the body which release saliva containing enzymes having anticoagulant effect and removes toxic blood out of the body. They draw out a small amount of blood while simultaneously promote healing and detoxifying effect. Another method of Raktamokshan is Ayurved or venipuncture. Ayurved involves controlled removal of some amount of blood through venipuncture which is similar to blood donation. It is performed in specific points or specific veins of the body, usually in areas associated with the condition being treated. In post-procedural care, wound dressing, rest and Panchakarma specific code of conduct is advised. Raktamokshan is advised for eliminating dosha in blood. It helps in improving conditions like psoriasis, dermatitis, urticaria, non-healing ulcers, recurrent abscesses and alopecia. Scientifically, bloodletting in controlled manner has been used in various medical traditions to improve blood circulation and to remove toxins in the blood. It is believed to enhance removal of metabolic waste products and reduce burden on circulatory system. Panchakarma are the post-procedural care procedures. It is indicated to bring patient's body back to normal physiological status. Thus, generally patients are advised to take rest for some days even after successful completion of the treatment. If we wish to make sustainable fire from single spark, we need to put proper amount of fuel in proper quantity. Similarly, patient's digestive fire is ignited and protected with some specific diet called as Samsarjan Karma. Initially, patient is fed only on hot liquid diet, then some thick liquid diet. Later, he is advised to consume semi-solid diet and finally is brought to full diet condition. This brings the digestive process back to the normal. Code of conduct after completion of Panchakarma procedure. Patient is asked not to sleep in daytime, not to eat heavy, oily or fermented food. Patient is asked to avoid waking up at night, avoid too cold or too hot environment. Patients are advised not to do strenuous physical exercises and avoid holding natural urges. These patients after Panchakarma procedure are asked to have simple, easy to digest hot food and take rest and keep themselves calm. There are many accessory Panchakarma procedures, we call them as Anya Karma, which are not exactly Panchakarma but used as local treatment for benefit of restoration of our health. Ashyotan is just similar to eye washing technique. Anjana is application of medicated material in eyes. Tarpan is medicated ghee is made to stay stagnant in eyes for stipulated period of time by making frame like dough around the eyes. Shirodhara is warm oil or medicated buttermilk is poured on forehead. Gandusha is oil pulling in which medicated liquid is held in oral cavity. Dhumapan is having medicated fumigation via nose and mouth. Karnapuran is medicated fumigation to ears. Sthanik Basti is medicated oil is kept stagnant at the some parts of body. Udvartan is powdered massage to the body, and Lepan is application of medicated paste to the body. These are supportive Panchakarma procedures. As a summary of introduction to Panchakarma, what we saw is diseases occur due to increased or aggravated dosha, vata, pitta and kapha. Ayurvedic modalities of the treatment are Shamana Chikitsa, that is pacifying, Shodhana Chikitsa, elimination, and Nidana Parivarjan, in which dosha aggravating causes are restricted. Panchakarma procedures are 5 detoxifying procedures. These are Vamana, Virechana, Basti, Nasya, and Raktamokshan. We saw Purva Karma, Snehan, and Svedan, which help to bring dosha back to the gastrointestinal tract. Vamana is elimination of dosha by stimulating vomiting. Virechana is elimination of dosh by purgation. Basti is the procedure of enema. Nasya is giving medicines with nasal route, and Raktamokshan is removing dosha in form of impure blood. Paschatakarma is indicated to bring back patient's body physiology to the normal state. In Paschatakarma, we saw rest, diet, and specific code of conduct is necessary. And finally, we saw Anya Karma, which are supportive treatment to the Panchakarma. I thank National Commission of Homeopathy for giving me this opportunity. I also thank my principal and director of MES IHS, Dr. Shyam Bhakre sir, for giving me this opportunity to present this topic. All the best, my dear students, for your upcoming examination and success. Thank you.